It's a couple minutes after 3, so we will get started with introductions, and as new folks come in, they'll just join us as we go along. So good afternoon, everyone. I am Susan Jenkins. I am in the Division of Evidence Evaluation and Data Policy here at HHS in ASPE, and the HHS Evaluation Officer. And part of my job is to oversee the deliverables and the work related to Title I of the Evidence Act. One of the requirements is to do a capacity assessment. And based on that capacity assessment, we have developed a series of capacity trainings. This is the 5th training for fiscal year 2023. We're very excited to have you here to join us to talk about evidence building and how it aligns with the federal budget process, how we can improve our ability, think more about including evidence in the federal budget process. And our panelists, who I'll introduce in just a moment, will draw on their deep knowledge of the Evidence Act itself, as well as experience designing, drafting, and reviewing evidence building plans, annual evaluation plans, working in the federal government as well as outside of the federal government. So they have a lot of different perspectives to share with you today. Before we get started, though, I want to remind you that this session is being recorded. The recording will be available on the HHS Strategic Planning Resource Center, so an internally facing resource center for HHS. When we have that recording up, we will let you know. And please submit your questions through the Q&A feature. We will have the Q&A feature open for you. We have a discussion that we'll be having, so we've drafted some questions to start us off, but we absolutely want to hear what you want to know about from our 2 very illustrious speakers. And so I will introduce our 2 speakers today. We have Dr. Demetra Nightingale and Dr. Nick Hart. Demetra Nightingale is with the Urban Institute, the Evidence Forum at the Urban Institute, where she has been for over 4 decades, and she is also a fellow of the National Academy of Public Administration. Previously, she was the Chief Evaluation Officer at the U.S. Department of Labor, and really they were a model for a lot of the work that we've been doing and other parts of the federal government have been doing. She has also taught at the Trachtenberg School of Public Policy and Public Administration at George Washington University and at Johns Hopkins University. Her research and evaluation focus on social, economic, and human services and anti-poverty and labor policies and programs. And she's an expert on the Evidence Act and evidence building capacity and infrastructure. So we're very lucky to have her here with us today. And Dr. Hart is the president and CEO of the Data Foundation. He is also a fellow of the National Academy of Administration and the Bipartisan Policy Center, and is an adjunct professor of the program evaluation at George Washington University. And he chairs the American Evaluation Association's Evaluation Policy Task Force and serves on the Coleridge Initiative Science and Technology Advisory Board, among other committees and boards. Previously, he worked at the White House Office of Management and Budget as the Policy Research Director and as the Policy Research Director of the U.S. Commission on Evidence-Based Policymaking, and the director of the Evidence Project at the Bipartisan Policy Center. I will also say that when I worked for the Administration on Aging, he was my OMB examiner for PRA. So I've known Nick and watched his career for quite some time. So I'm very excited about that. And he's an expert in the United States policy related to data, evaluation, statistics, science, and privacy. And during his professional career, he's led initiatives in government and in nonprofits, championing the use of data to improve society. So we are also very lucky to have Dr. Nick Hart with us here today. And so I'm going to turn it over to each of them in turn, and then we will have discussion. So please put questions in the Q&A feature again throughout the discussion, and we will have some dedicated time near the end of the session for those questions, but we will integrate the questions in as we go along. So first I will turn things over to Nick to talk to us a little bit about how did we get here in terms of the Evidence Act in terms of the requirements under the Evidence Act, and just the push in the federal government to integrate evidence into policy making, into budget processes, into programming. And then I'll turn it over to Demetra to also talk a little bit about generally about her experience at the Department of Labor and how she really made that into a model for federal evidence building and infrastructure related to evidence building. And so she will talk about that, and then we'll open up to questions. So Nick, I turn it over to you first.
All right, Susan, thank you so much for the introduction. And it's a good little flashback to when we first met many years ago. I think ACL was just coming into fruition with a name change, Administration for Community Living. So in terms of the story about how we got here, I mean, it's actually just a fascinating timeline. And I might even just start by saying some of it's on purpose and some of it's by accident. But much of the story is actually a credit to many of those who are on the line right now. Some you can see on screen. Many of you who are joining, whether you've been working in this community for a year, a decade, or multiple decades, or whether you're brand new to the community. HHS has been part of the story of evidence building and evidence capacity for a generation. The Department of Labor, the Environmental Protection Agency, all the way back to HEW, was really part of the huge motivating factor for where we find ourselves today. And Demetra, I hope you're going to agree with us when we turn to you. But so much of the work that is happening today in government is actually because of the work that happened many decades ago. And I mean, I worked with the US Commission on Evidence-Based Policymaking, which was much of the genesis of the momentum that we're currently watching. However, the reason that so many of the hands went up to say, can we do this better? How can we think about linking this data to that data? Can we answer these big, wicked questions? Is because of a lot of the success stories that were already happening in agencies. We were able to demonstrate through whether it was big program evaluations or demonstration projects, that this was actually possible, that we could use program evaluations in practice, not just for big political questions, but actually supporting program administrators. So I'm putting this all in a very positive framework because a lot of times when folks approach the questions around evidence-informed policymaking or thinking about the budget and evidence, it's with a big stick in mind. We're going to use the evidence to cut a budget. But this is often framed around, how do we make things better? How do we use evidence to improve, to learn? And I'm going to say at the outset, and I'm a former OMB person here, a lot of times we're thinking also about how we apply the evidence to support programs to maybe even give them more money. So fast forward, in 2016, we were creating the Evidence Commission. The whole story of the creation of the Evidence Commission was actually around budgets. Paul Ryan and Patty Murray were the respective budget chairs of the House and the Senate, and they were in a knockdown, drag-out budget fight. And it was exactly this conversation of how do we better answer some of the big, wicked questions that we have that we should be able to answer. And the reality is we should be able to answer a lot of those questions. So we knew that there were supply problems of we're not generating all of the kinds of evidence that people want, whether you're in Congress, whether you're an appointed official in government, or whether you're a program administrator on the front lines. Sometimes whether you're buried in the depths of an agency doing the hard work, just trying to get performance indicators. Those are all hard tasks where you need different types of evidence. So the senior budget officials knew that. But they also knew government was collecting a lot of data today at this moment, or a decade ago, I guess now. They knew we were collecting a lot of data that could be better harnessed. They also knew there were places where there were big data gaps, things that we could better leverage from the private sector, or places where we might need to collect new information, and then maybe even link those data sets together, generating new data sets or new ways of thinking and analyzing information. So they agreed to figure out a better way to analyze, or how we should analyze that. They knew we needed a plan. So that was the genesis of the Commission on Evidence-Based Policymaking. back in, was actually way before 2016. It took a few years to get through Congress, but it did. And that commission existed in 2016 and 2017. And I think a lot of people in our community often believe it existed solely to answer questions about data. And in fact, the original proposal to create the Evidence Commission was exactly that. It was this idea of creating a big data warehouse. And I for one, am really happy that the final result of the commission was so much broader. It was actually about evidence-based policymaking. The final product of the commission had 3 core themes. So they said, we have a lot of data. We need to improve access to that data to actually answer these big, wicked questions. So that's theme number 1. If you improve access to those data, you need to be mindful of privacy protections. And you can go super deep weeds on that. And then the third theme was, if you're going to improve access and ensure those privacy protections are robust, you must have the core capacity in place to not just produce evidence, but also ensure that it's meaningfully used. And that comes in lots of different machinations. Could be around budget decision-making, could be regulatory, could be day-to-day decision-making, all of the different configurations of use. So 3 core themes. The commission then produced 22 recommendations to be precise. And some of those are very familiar because that became the basis of what we now know as the Foundations for Evidence-Based Policymaking Act. Susan alluded to it. There are half of those recommendations included in the Evidence Act today. 3 core titles. Susan alluded to Title 1, which has a lot of the core capacity elements. So we think about these evidence building plans that outline, we also call them learning agendas. Evidence building plans connect the dots between the supply and the demand for evidence. We say these are the big questions that we have. And what are the core components of evidence that we need to be generating in order to answer those questions? We have evaluation policies, practices. We have evaluation officers. That's all in Title 1. Title 2 is really key because it's called the Open Government Data Act. We have these philosophies in our government around transparency as a way of building public trust. That means we have to organize our information and make it accessible. So chief data officers are embodied in Title 2. And then Title 3 enables more data sharing and data access for particular kinds of data. So for those that are familiar with the federal statistical system at HHS, the National Center for Health Statistics, for example, that is part of Title 3, the Confidential Information Protection and Statistical Efficiency Act. They call it the strongest privacy law in the world that most people don't know about. When you take those 3 things together, it is an incredibly powerful law that is actually intended to improve our ability as a country to produce evidence and then make it useful and used. So what does all of that actually mean? Well, it was intended to change the way that we think about generating and using evidence in agencies. It was intended to eventually shift the cultures of agencies by putting the tea leaves in place of things that can happen around building capacity, having the people, the processes, and eventually making it easier to share and use data. You can't change culture in a law. The Evidence Act sets some of the pieces in motion to make it possible, but it requires people like Susan and the evaluation officers, the CDOs, the statistical officials, and the leaders inside the agencies to really leverage this law and run. And a lot of that's happening. I know we're going to talk more about this, but the Evidence Act sets in motion with the White House's support, with the agency leadership support, a lot of these pieces. And it's really important to also note agencies, in many cases, the operating divisions of HHS are a good example of this. We're doing a lot of these activities before the Evidence Act came into place, and to great effect. So this is just a way of accelerating a lot of the great work that was already happening. I think Demetra is going to provide us some great examples of exactly that from the Labor Department.
Thank you, Nick. So with that, yes, Demetra, please tell us a bit about what you were doing at the Labor Department, how you really set up such a vibrant culture of learning and evidence building.
Okay, well, first, thank you, Susan and Nick, for setting all of this up and for giving a great overview of both the Evidence Act and sort of the direction that I think HHS is going in, as well as many other departments. I was asked to join the U.S. Department of Labor as Chief Evaluation Officer in 2011. The first evaluation officer was Jean Grossman, and she served for about a year and then returned to Princeton. So I was the second. When I arrived, there was virtually no funding for that office or for evaluations, but there were 2 career staff that the secretary funded, and they had evaluation training. So having evaluation specialists with the appropriate training around program evaluation is really critical. When I left 5 years later, we had an increasing annual appropriations for the office, and we also had a separate set-aside funding, which could be tapped up to 0.75% of all operating funds in the department. And we had about 20 full-time evaluation specialists. And then we had many other staff throughout the department who joined us for 6-month rotations in the Chief Evaluation Office. All of this was before the Evidence Act was passed. So like HHS, and as Nick just said, the Labor Department has a long history of conducting evaluation and research, especially through the employment and training programs and the Employment and Training Administration, but also in some of the worker protection and regulatory agencies as well, such as OSHA for Occupational Safety and Health. And the Bureau of Labor Statistics, of course, has extensive analytic responsibilities and highly technical staff. So each of the 17 operating agencies in the department had some type of evaluation, research, or analysis office or staff. Some initiated evaluations themselves. Some conducted data analysis or statistical analysis or various types of research. So I'd say that there were 3 ways that we tried to build a culture of evidence throughout the department. It was a challenge because of the discretion that each of the agencies have, but also an opportunity. First, we sought to build on the existing analytic foundations that did exist, but we also recognized that the agencies and programs were at different stages. Not all of them could undertake the same kinds of studies or research or analysis. We did not replace what they were doing. We didn't centralize all of the research, and we didn't oversee all of the research and evaluations. We wanted to complement and supplement their research efforts, and eventually, once we were able to get appropriations, fund much of the research or partner with them for funding. We had joint funding opportunities. So that connects to sort of the second point that I wanted to make, which is I always considered, and I hope there are program people here today as well, I always considered that the operating agencies and the administrators and staff in the operating agencies and in the field were our office's priority client and stakeholder groups. And they also became our critical partners. If you don't have the support of the program people, it just becomes a bureaucratic exercise. So you want to engage the program people. And third, we strategically moved to establish some of the key research activities that could raise awareness about evidence and share findings from studies, inform the agencies and programs about existing research and evidence, and integrate evidence through evaluation, data, and research into management functions, which I'll talk about in a minute. So just to give you an idea of some of the things that we did, we tried to support cross-agency evaluations that no single agency would necessarily do on their own. It was a way to identify us as doing something different and complementary. We also developed an evidence-based clearinghouse called CLEAR, Clearinghouse of Labor Evaluation and Research, which included standards and ratings for the quality of studies and the degree of impact. And that clearinghouse just keeps getting better and better. And it has a mix of rigorous impact evaluations, but also other types of studies such as literature reviews and statistical analysis with methodological standards for each type of evidence and not just impact evaluations. We worked with the agencies, the operating agencies, to decide what topics and issues should go into CLEAR, so that it was they had a say in the evidence clearinghouse as well. Another thing we did was formalize what we called a learning agenda or an evidence building plan process, which was for us an internal living document, I think it still is, and from the agencies, which could be updated continuously, but ultimately formed the basis for the formal public department level, department-wide evaluation plan and evaluation budget. So each year, our evaluation specialists worked with the operating agency liaisons to draft their learning agendas and identify priority topics or issues that they wanted addressed through research and evaluation. Over time, we expanded that process, that engagement process, to provide input into the drafting of the departmental strategic plans and the agency strategic plans that rolled up to the departmental level, agency budget requests. The budget requests and justifications increasingly included short statements of existing research, gaps in research, planned research, and evaluations. I was fortunate that both secretaries that I worked with and the deputy secretaries did require the agencies to include evidence in their budget justifications. So that was good. So it's having the evidence pieces, whether it is summary of research that's been done or gaps, or increasingly a plan for evaluating whatever it is that they're talking about proposing for new funding. That strengthened their position both within the department and at OMB when reviewing the budget submissions. And we developed a really close cooperative arrangement between our office and the Departmental Performance Management Office. Studies in our evaluation plan each year included some studies that were addressing performance issues, such as statistical analysis of factors like economic conditions that were associated with intermediate or final outcomes, or analysis of quality and quantity outcome measures, or helping to create logic models for a particular type of outcome measure, so that our evaluation specialists worked with the agencies as they were refining their performance management and their strategic plan and their budget submissions. So yes, we procured formal evaluations, of course. The name of our office was the Chief Evaluation Office, still is, and they sponsor many external formal evaluations like HHS agencies do. And they were focused on the top policy and priority issues for whatever administration or agency, or congressionally mandated studies, of which there were many. But we also had in our office a big focus on capacity development. We worked in partnership with operating agencies, as I just said, but also to improve the data quality and access to data, to incorporate research and analysis into the ongoing management activities that I just mentioned. Our mission was to show how research, analysis, and evaluation is a plus, can help agencies and programs do what they have to do and achieve their purposes. I was very proud after probably the second year I was there, where I had assistant secretaries coming to my office asking for help. I mean, that is a sign of that something that you are producing or that you're doing has some value. So it was not a mandate to the agencies, but a support for the agencies. So I'm going to stop there, but I'm glad to go into more detail on these. I have many other examples I can give you, but it was really what we were trying to do was raise awareness and show relevance and usefulness of evaluation and evidence, and to take a broad view of evidence so that it was not just impact evaluations, but all types of evaluations, plus performance management, plus data analysis, plus statistical analysis. I met every 2 weeks with the commissioner of the Bureau of Labor Statistics and the performance management officer. And that is continuing also today. So I'll stop there.
Thank you so much. And I do see a lot of parallels with where we are at HHS. Our recent capacity assessment indicated from the respondents that we do have more call for evaluation than we have capacity for evaluation. So in that sense of our operating divisions really having good reputations in evidence building and people coming to them, we are seeing some of that. But Nick, I want to touch on something that Demetra mentioned in terms of having good evidence, putting the department in good footing with OMB. You worked at OMB and still have close relationships with OMB. So as we think about the Evidence Act or other evidence through the budget process that OMB requires of agencies, can you talk a little bit about what might be some tips or some ways that we should think about how we present our evidence to OMB? And that can be through the Evidence Act deliverables or through other aspects related to the budget. But can you talk a little bit about the OMB review process in terms of evidence and how we can package our evidence to be most useful, best accepted by OMB?
Yeah, absolutely. Well, first thing I should say is I don't currently work at OMB, so all I can do is offer some perspective. OMB is a small place, and I was shocked when I began working there now a very long time ago, and just how few people actually work at OMB. And I remember going to a conference that was supported by, at the time I had oversight of EPA, and one of the EPA employees said, "Oh my God, there are people that work there." And you're all probably laughing, even though we can't see you, because a lot of times things go to OMB and you see a name on an email or maybe there's a phone call. But this is a commentary about how important the relationships and the people are first. And so many of the things that we do in government, and to also know that the portfolios that the individuals working on at OMB are immense. They are massive. And that is context that is so important in thinking about this question. Just in the same way, if you were asking about Congress or a decision maker, the context for what people see is important for how they are going to interpret it and how quickly they can parse it. So helping them digest the material and process the material as quickly as possible is an important framework for thinking about the user on the other side. A long time ago, we had the program assessment rating tools. And I know a lot of people in government like to bury that, or we try to forget it. But from an OMB perspective, it was considered a very useful mechanism as a way of distilling information, because agencies did a lot of the hard work in processing and then submitted it to OMB for review. And it does not mean that there were not disagreements or arguments about what the conclusions were, or even in some cases what the evidentiary basis were for the numerics and the index of the part. But it was a positive set of discussions from the OMB lens. Now, having given you that context, when we talk about learning agendas or capacity assessments or the evidence that's presented in the OMB justification that precedes the president's budget, my advice is to be honest. The OMB examiners are there with a very specific role. And I think in a lot of cases, there's a perception that their sole function is to figure out how to cut budgets. But the more that they know about the value of programs and also what the evidentiary basis is, the more they can also be in a defensive posture. And yes, it is true that there are budget guidelines, and on the discretionary side in particular, there are targets that they will have to hit. But that is all the more reason why having a strong evidentiary basis is really important. And when it is clear to them if there is a compelling case for more resources because something didn't work as well as intended, they can make that case. And I'll give you an example. A couple of years ago, we had a really strong evaluation of the Second Chance Act that had really underwhelming conclusions from what was expected as the intended goal of the program. However, there were really positive outcomes for the secondary objectives of the program, not the intended objectives. That program was up for reauthorization, and it got into a debate with individuals in Congress about what to do. Should the program be reauthorized? It was fairly expensive. And instead of axing the program, headline, it was reauthorized, but with modifications. The actual issue at hand was the technical assistance centers weren't getting the support that they needed. So evaluations can actually help us distill what the nature of a problem is. And also, Demetra, you write about implementation evaluation a lot. So implementation evaluations can also be really useful for OMB in diagnosing how to provide support. So OMB can be supportive, and my advice is to use them as an ally. Now, take that with a grain of salt, because every program is unique, and you all know your contexts. I would also just maybe add one last thing, which is the congressional justifications that we present in the budget are also a way of communicating with the American public. There was a law that was passed a couple of years ago called the Congressional Budget Justification Transparency Act, which is a way of improving how we communicate those documents. So for every program right now, it's also a way of us improving public trust in our programs and communication about what works, not burying the studies in databases, which is important from a research perspective and an evaluation perspective, but basic communication. We can use the CBJs to greater effect. That also involves OMB.
And something I think to add on to that, as we think about we have an HHS budget justification that comes before the OMB budget justification that, as you mentioned, comes before the congressional budget justification and the president's budget. Many times there's very limited real estate in those budget documents. And so, per HHS's evaluation policy and the requirement to publish and make transparent our evaluation work, transmit through our evaluation plans what we plan to evaluate, and then publish in as timely a fashion as possible our evaluation results. And then that allows a couple of things. Folks that are researching or working with us, and that could be OMB staff or other staff, can easily find that material. It's not hidden in a database, as you suggested. And then also we can link in that limited real estate that we have in our budget justifications to those studies. So we can show that we do have these studies, we do have this evidence, and while we may not be able to fully explain it in our budget justification documents, we can highlight that and folks can then easily find that information, and that can be really helpful.
I will just tell you, OMB reads the footnotes.
They do, yes. Thank you. Demetra, I want to touch back on something else that you mentioned. You were talking about the divisions, if you will, that's not really the right way to put it, but the divisions and the role of the divisions and the programs, as well as the role sort of the office of the Chief Evaluation Officer. And can you talk a little bit about how we can create at HHS a coherent picture of HHS? Because similar to Department of Labor, we have a lot of different divisions that do a lot of different things, focused on health and human services, but in many different ways, many different populations, and a range of different things. Can you talk a little bit about how we can create a coherent picture at HHS, but also for some of our larger operating divisions that within themselves have a range of different things that they're doing?
Yeah, I mean, I was very fortunate in the moment that I was at the Labor Department, because there are two answers, I think, to this. One is that I don't know if all agencies still adhere to the GPRA review requirements with the deputy secretary or whoever the chief operating officer is of a department. But the quarterly meetings were a way to have a department-wide focus and priority on evidence and evaluation, as well as performance. And so the deputy secretary at that time consciously included evaluation as part of the GPRA meetings with the assistant secretaries. So, and I was in every quarterly meeting with every agency, which I think is a little unusual, but I was, again, fortunate because of that time, that's the way the meetings were set up, which meant there was a top-down priority on evidence, but at the same time, the evaluation specialists were really working within the agencies, so that we were trying to work from both the agency level and from the secretarial level at the same time, and integrating the focus, the departmental level focus on evidence through the performance, as well as all of the strategic planning and budget preparation activities. So, I think that's one way we were able to sort of institutionalize an understanding of evidence. A few other things that we did, I'd mentioned the clearinghouse, CLEAR. It would be very easy to focus on the agencies that do a lot of research and evaluation, or that have a history of doing it. But if you do that, you're leaving out a big portion of the department, especially in the field. And so we made a point of making sure that we had studies with every agency. So by the time I left, every agency was doing some type of an experimental design evaluation using random assignment, which when I started, I never would have thought that would have been possible. We even had the solicitor's office with the appellate attorneys doing some RCT evaluations. And so that over time, the value of evaluation became more important to each of the agencies, and that caused sort of a departmental picture, a departmental focus on it. The way that I tried to do this is to have some quick wins, have some studies that were coming out soon, not waiting 5 years or 10 years for the fancy gold standard impact evaluation, but to do some rapid cycle behavioral studies using random assignment and RCTs when possible, doing some also rapid evaluations of procedural changes, so that it was not perceived to be an up or down vote on a particular program, but rather an approach that can be used to determine whether you want to proceed with a change in procedures. And that's what the lawyers were doing. So, I think that what we tried to do was come at it from every direction. And we also had another piece that I thought was very important was we had CEO evaluation brown bag seminars. And what we tried to do was pick topics that were broadly of interest throughout the department. So I'm trying to think of some examples. One that had a lot of interest was human trafficking, for example. Another one was services to ex-offenders and reemployment of formerly incarcerated people, youth employment. There were a number of issues, health and safety in the workplace. So we would pick a topic and then have a presentation either by an external researcher or evaluator or one of our internal analysts, do the presentation of the findings, but I would incorporate in the methodology as well, so that it wasn't a brown bag on methods, it was a brown bag on the topic. But I picked topics that had strong methods as well, so that we're coming at it from both directions at the same time. And I think today the Chief Evaluation Office there has, I think they call them coffee break videos, and they have, just short things that are easier to do remotely. We did these things in person, but now there's much more of a focus on remoteness and short snippets rather than long ones to get the program people engaged rather than just talking to other evaluators. So.
Excellent, excellent. And that is a bit different than the way that we've been doing our capacity building, where we have been focused more on the evidence building focus as opposed to the substantive programmatic focus. And that seems like something that HHS would be very ripe for to try that.
We mixed it up a little bit, mixed it up a little bit, but you get a different group of people to attend that way. So. And
you make them fall in love with methods, even though that's not what they were expecting to do when they showed up.
Or they're at least familiar with the terms and the terminology. What I did find was that throughout the department, I'm sure HHS is the same, there are a lot of federal staff who have evaluation backgrounds, either in graduate school or something. They may not be doing evaluation or research currently, but they're glad to communicate with and to collaborate and to hear what other people who have research backgrounds are doing. So it became then an opportunity for a sort of a little forum where people from all over the department could get together and hear some of the things that they used to hear about in graduate school, and that became very popular.
That's a great idea. And a question that I have, you mentioned that eventually everyone was doing randomized controlled trials. So sort of a quick question.
Everybody was doing at least one. Some of the agencies were doing a lot of them, but I felt successful if we're even doing one.
We would as well. I think that's fair to say. How did that happen? Did you support the capacity building? Did you help them to work with contractors to build that capacity to do randomized controlled trials?
Well, I mean, we did it in different ways and with different departments. All of our evaluations were externally procured for attendance, and but I think starting with the low cost studies and the low burden studies like the behavioral tests and rapid cycle was an easy way at the time, when Moneyball and things like that were becoming known, and the White House had their evidence office at the time, the behavioral tests. So it became okay to do that, and it was beginning to become more evident in the public media, and they sort of liked being able to do studies like that. I mean, one thing that we did internally, we did some internal studies as well, but internal one we did was to tell, and other agencies like Defense, and I remember Defense, I can't remember what the other agency was that joined us, where we did some behavioral testing to see if by changing communications you would increase the voluntary contributions into the retirement system. And we were testing different psychological messaging to increase the voluntary activity in that regard. And agencies sort of liked seeing those results. The enforcement agencies liked seeing studies that were trying to increase voluntary compliance by businesses, by employers, to increase accuracy of reports that were coming in from the business sector of schools or training institutions. And so behavioral tests, I think, were a good entree point for some of the rigorous kinds of methodological approaches.
Excellent. And that White House office, I believe, has moved over to GSA, and they are the Office of Evaluative Sciences. And so that still does exist. It's just moved to a new location, but still doing that kind of work. So folks, please put questions in the Q&A if you have questions for Demetra or Nick or both. But as we continue on, a question to both of you. Sometimes we have to make do with the evidence that we have. There may be opportunities sometimes to build new evidence, to access new data, but sometimes we have to make do with the evidence that we have. Do you have some thoughts or suggestions for making the most of evidence that may not be the ideal evidence that we would like to have?
Yeah, I mean, yes, I mean, I've been a researcher and evaluator for 50 years, so that's what I've had to do for 50 years. I think it goes back to, I think Nick said, be honest. You want to be honest and truthful about what you've got, and not try to spin the less than perfect evidence in any particular direction. But that being said, you need to be humble about what the findings are. You can use it as a way to identify the gaps. One of the examples that I'll give for this is, and again, in employment and training, there's been a lot of research at HHS, education, commerce, justice, the labor department. We've got a lot of research that's been done on employment and training. And when the new Secretary of Labor came in, the very first day that he was there, he called me into his office and he said, "So what works in job training?" Okay, now I had at that time 40 years of experience, so I knew what the literature had to say, but could I condense it down quickly enough and identify and not oversell it? Well, I said, I'll give you something in the morning. And that night I wrote 2 pages, and as concisely as I could, with the main points of 40 years of research without getting into all the technical details. But I was careful to say what we do know, what we don't know, what we still need to try to identify. And eventually, a year later, that became then a White House report for then Vice President Biden on what works in job training. And we had 5 agencies that contributed to that report. And I set it up the same way. I was the major writer on that, although my name doesn't appear anywhere, and that's fine. But it was the same thing. What do we know about what works for adults? What do we know about what works for youth? What do we know about what works for women or disadvantaged? What do we still need to know, and where do we go? Where do we go from here? What are the priorities? And I think if you're honest, you can do it. And the other challenge, I think, is people are afraid of negative results. They're afraid of negative findings, because I know Nick said that OMB isn't trying to cut budgets. Well, sometimes some administrations are using evaluation to cut budgets, and that was one of the quirks about PART, but I don't want to get into PART. So the focus was really on identifying positive directions that could be taken to improve programs, not up or down votes on any particular program. And it means that there is evidence is not. No, one study does not make evidence in my book. You need a body of evidence to know if it's going in the right direction. So we never have perfect knowledge, and we never have perfect evidence. We just keep at it. Like I said, I've been doing it for 50 years and maybe 50 more.
So I'm mostly going to reinforce Demetra. So when I was at the White House, I once watched someone give a hallway briefing to the chief of staff on something I was working on, and they were wrong. It was faulty evidence, and it sent us in the wrong direction that we later had to course correct. Mm-hmm. And this is a message about humility. It was one of the principles of the Commission on Evidence-Based Policymaking for a reason. They had 5 of them. And it is my favorite of the principles because in this policy space, it is so critical that we acknowledge what we know and what we don't know. Right. There is no perfect study. Give me a study and I'll find a problem with it. Whether it's a randomized controlled trial or a qualitative research study, there are always limitations to every single study. Humility is essential when we talk about evidence. Acknowledging the limitations are always relevant when we're making policy recommendations. I cannot say that enough. And if we oversell, people won't trust our evidence. They won't trust what we're doing. We have to have trust in order for evidence-informed policymaking to succeed. Full stop.
Excellent, excellent. And we are closing in on the top of the hour. We don't have any questions from the audience at this point, so let me offer my last question for the day, and then at the end, just for the audience, we will give you a couple of minutes before the top of the hour to fill out the feedback survey, because we want feedback on these sessions to make sure that we're providing capacity building sessions that are helpful to you. But before that, I would like to ask each of you, and I'll start with you, Nick, and then go to you, Demetra, if you want to leave us with something, so other than that principle that's your favorite principle, if you want to leave us with something else, what message do you want to leave with us about using evidence, building evidence, integrating evidence with the budget making process? What is a point that you want to make sure that you leave with us?
This is hard. Sometimes we get it wrong. And I put this in a positive framework. When I was OMB, rewinding very far, I once beat an agency up for having a major initiative about evaluation capacity. Fast forward many years, and I'm now a huge advocate for building evaluation capacity. They were actually doing everything right. They're a model for exactly how to do this. It was not HHS, by the way. This is a really hard thing to do because it takes so much time and energy, and all of you are part of this. So the thing that I would leave you all with is, don't be discouraged if it feels hard, if it takes time, if sometimes it's like one step forward, two steps back, because collectively, this is headed in the right direction. We're making progress, and we need you to stay engaged and continue leaning in on the topic.
Excellent. That's my favorite word, be relentless. Relentlessness, that's my favorite. Demetra, what's something you want to leave us with? Maybe something unexpected or a point that you want to really make sure that we leave with?
Well, I mean, there are probably a lot of them, but one thing that I think is important to leave with is that you want evaluation, as I said, to be useful and helpful to the programs and the agencies. The role of government is not necessarily to evaluate, to manage performance, or to have data. It is to carry out the functions of serving the people and family and cities and counties, and doing what the agencies and programs are intending to do, which to me, because I had been outside the government, we were evaluators, and I didn't realize how important that relationship building with the programs and evaluation would be, and the importance of communicating and the communication approach with the program people. And so to me, one of the unexpected but probably most important things that I learned was as I started my talk today, that the program operations, whether they're in the field, whether they're in Washington, that those are my primary clients for building evidence. If you don't get the support of the program operational offices, you can't really institutionalize a culture of evidence.
Excellent. Thank you both for those last thoughts, and thank you both for all of your time and your tireless efforts before this point in working to build evidence. We really appreciate it. So I thank you very much. And with that, we will close out the session, and there will be, once the session closes out, a feedback form will pop up. So thank you, everyone, and have a good rest of the day.
Thank
Thanks,
you.
everyone.